Hey there, we are going to talk about working on the upper traps. There are some things that I do to the upper traps that I want to show, and hopefully someone can pick them up and do it to me, because we all do the massage that we want to receive. And so I do the things that I want done to me when I'm working on people. And I've got Sarah here helping me out today. Thank you, Sarah.
Hi.
And so, as I was talking to Sarah about earlier, we're all experts at the massage that we do. No one does your massage better than you do. So I do deep tissue work, and what we're gonna do is, since we're just working with upper traps, I'm just gonna uncover a little bit of the upper body here with Sarah. Before we get into deep tissue work, we always wanna test the hydration of the tissues. In the Chinese tradition, a wise woman tastes her food before she salts it. So we want to check in with hydration of the tissues before we add any lotion. That helps us achieve this hook, helps us get into the tissues better to get that deep tissue work. We're trying to get that hook, and we're not trying to glide. Think about it like you're trying to open a doorknob. And if you were to put a whole bunch of oil on the doorknob, try opening the doorknob. Not very easy. So if you didn't have any oil on your hand, you're able to get that grip on the doorknob and open the doorknob. Does that make sense? Hope so. And with Sarah, she's got some pretty good hydration, so I don't know that I'm gonna need even any. I might need a little bit because my hands are dry. The stuff I'm using is a solid lotion. It has beeswax in it, and it has coconut oil, some shea butter, but that's about all I'm going to use right there. So as you can see, we already got some hyperemia going just with the little work that we did with her. We're just going to check in with Sarah's upper trap. So we're going to use this tool that I call the modified fish hook. It's going to be using the flat part of your middle and distal interphalangeal joints. Your middle knuckle and the end knuckle right there, so the flat part. I don't know if you can see that or not, but the flat part right here. The fish hook is a tool that uses both fingers, but we're going to pare it down to just one. So we get in there and we work with just this part of our knuckle. And we're using that good body mechanic, so I'm not gonna come in here with my shoulder, but I'm gonna use my whole body weight to come in, and I'm just gonna lean forward and come in and put some weight. So if I were doing this, you probably can't see this as I'm doing this now, so I'm gonna do a little bit of air massage, but as I lean forward, this is the pressure that I'm getting right here. My arms stay long and locked, and I'm gonna fall down the mountain. I'm gonna fall down from the middle line of the body, so more toward the neck, and just let that fall down the traps until we hit that medial border of the scapula. So one of the things that we do in deep tissue work is we have to check in about pressure. And how do we do that? We don't ask, is that pressure okay? Because what's the response we're gonna get? They're gonna say, it's okay. So when we check in about pressure, we check in and we say, so Sarah, in terms of pressure, does it feel like your body wants to try more pressure, less pressure, or keep it about where it's at?
About where it's at.
And she says about where it's at. So I would say I'm using fairly moderate pressure. So right now, I can get in there and just hang out on the levator scapula, which lives at that superior angle of the scapula. And we can check in with Sarah about pressure. And that's something that's gonna be hard for me to do as I'm talking and trying to stay focused on what I'm doing with Sarah. But Sarah, what are you noticing right here?
It feels really good, actually. Right on a spot that I definitely need some work.
So she says it feels pretty good and that we're finding a spot that she feels needs work. And that's another reason why we check in and see what the person on the table is noticing. So instead of warming passes, what we use are what I call assessment passes. They do help warm and hydrate the tissues, but we're using them to assess the tone of the tissue, right? We're assessing, is there something going on here? Does this need more work? Can we skip this part and move on to other areas that may need more attention? So that is the difference between a warming pass and an assessment pass. They're probably both the same thing. It's just how you word it and your intent. There's a lot that has to do with intent of massage. We have to get through superficial layers first before we can get to deeper layers. We're still going to be affecting those superficial layers, but our intent is to get to those deeper layers. One modification I make to my body mechanic is instead of keeping my arm long, I can bend at the elbow and bring the elbow into my rib cage, so I can use my body weight to come forward as I'm locked in at that elbow. See how that works? So I'm not using my shoulder to muscle through here. We want to use leverage and body weight as much as possible. If we have to resort to using muscles, we want to use larger muscles first and then maybe go to the smaller, weaker muscles to help with massage. Because if we're using small muscles and if we're using muscular effort all the time, we're not going to be massage therapists for very long. So you can also do what I call milking compression, or some small cross fiber friction to the muscle. So if you know the direction of your muscle fibers, so we can just put in some cross fiber friction there. And that's how I get into that body mechanic where I lock in my elbow and bring in the work. You also notice with the other hand, I'm putting in some passive movement to move her shoulder down and away from her ear. So what this does, it helps to lengthen this upper trap, and it helps to lengthen this levator scapula. Now we could have her do this movement on her own. So what I would say would be, Sarah, can you just slowly slide your arm toward your feet? So it doesn't matter, we're not worried about distance. There's no such thing as too small of a movement, and there's no such thing as too slow of a movement when doing this. So we talk to her and we have her engage that movement for about 3 to 4 seconds or so, and then relax back to neutral for about 3 to 4 seconds. And then just back and forth like that at your own pace. There's no right or wrong. So what this does, she's engaging some of these lower muscles, the lats, and what that does is through reciprocal inhibition, we'll turn off the upper traps and we'll turn off the levator, which allows us to get in deeper with using maybe the same amount of pressure or even less pressure. So then we check in with Sarah. We say, Sarah, do you notice any difference as you bring in that movement? Do you notice any difference in sensation? And she says,
yeah, I feel like a good stretch, but it also feels like you're working a little deeper into that muscle.
Right, so she says it feels like I'm getting in deeper into the muscle and she's feeling a little bit of a stretch. There is not a lot of work going on. You probably can't see much. This is all about the quality of the work and not the quantity of the strokes. So I'm not counting, how many times have I done this? Is it 3 strokes? Is it 5 strokes? No, it's all about connecting into the tissue and allowing myself to move through the tissue. So we're not plowing through the tissue. And once again, a friend of mine, one of his favorite sayings is allow, don't plow. So allow yourself to move through the tissue and don't plow through the tissue. So we're going to switch up to working with the upper trap, and we're just going to use this tool called our finger pads. We're going to use the finger pads to hook into the hood of the upper trap and to just work our way from anterior to posterior and work superior to inferior. So we're working from front to back and top to bottom. Because what happens in most people, our shoulders get locked in, rounded and forward, right? We get into this zombie position where we come forward. So we're gonna take this tissue and we're gonna bring it back, right? A lot of times I see massage therapists, they will do a little something like this. They'll get in with elbow and they'll bring all that tissue up toward the head and neck, which is fine. It probably feels good. But like I said, this is selfish on my part. I want to show what I want done to me. So hopefully somebody can see this and say, hey Ben, I want to try that. I want to try that on you. So cool. So we've got the finger pads, and we're just gonna encourage this tissue. It's not super deep. We're just gonna encourage this tissue from head to toe and from anterior to posterior. So that's my assessment. I've done my assessment. So now I can get in with the deeper tool. I can get in with my elbow. So we're gonna use the same body mechanic we're using before, but only we're gonna come in with the elbow. So if I were to show you without connecting into Sarah right now, it would look a little bit of something like this. I'm just coming forward. I'm not using any of my shoulder muscles to move. I'm just coming forward like this. So you'll see what that looks like when we connect in with her. So I scoop up from below and I just connect in to that upper trap. And now my intent is to move forward. I'm not lifting my shoulder up, but what's gonna happen is my elbow is gonna rise and follow her back as my intent to come forward, my body weight come forward through this technique. And as always, we check in with pressure, but since she's doing okay, but we would check in and say, does it feel like you need more pressure, less pressure, or keep it about where it's at? Yeah, so we're gonna keep it about where it's at. So when we get to a certain point, we're gonna have to transition our body mechanic, because we don't want our work to get too far in front of us, because that's when we start to get that curve in our low back. So as we come forward in that body mechanic and we scoop up, we get to a certain point where the work is too far in front of us. So now I have to move my lower body. So what that entails is a little bit of getting up on the feet and a shuffle step to follow this work. And then once again, the work gets out too far in front of me, we shuffle step. So all of my work is coming from my back leg. I'm not doing any work with my shoulder to try to move this forward. It's coming from the back leg, pushing me forward this way. So my back leg is pushing me forward, and that allows my shoulder to stabilize the work, and I can work with the elbow. So we're getting that hook in the tissues. We're not gliding. This is not Swedish work. This is deep tissue work. So this is specific work. We want to be specific with our intent on what we're working on. So everything we do should have a purpose. There should be a purpose behind everything we do. So here we're connecting in with that. My intent is to connect in with that upper trap. Now we are going to be going over top of rhomboids. We're going to be going over top of serratus posterior superior, but our intent is just to connect in a little bit more superficial with that upper trap, and just to bring those tissues back and down toward the hips. She can reach her shoulder away from her ear if she wants to. And we taught her how to do that. We engage that for 3 to 4 seconds, and we relax that for about 3 to 4 seconds. Or we can do it passive, where we do it ourselves. And usually if you give the body 2 different choices, it has a pretty good idea which one it wants to do better. So if we check in and we say, Sarah, does it feel better when you shrug your shoulder down? Or do you like it the passive when I do it for you? Or do you like neither of them?
I like it when you do it.
Yeah, so she likes the passive work. Some people may prefer the active. It's just kind of, you give them options. And that's what communication is about on the table. It's not communicating about their trip to Disney last week. We're communicating about her body, and we're keeping her awareness in her body so that she can keep that mind-body awareness and have a little bit more effective body work. So it takes practice to learn how to get a massage, right? We teach the people that are coming onto our table, we teach them how to get a massage from us. They may have had massage somewhere else, but they haven't had massage from us. So we teach them how to receive massage from us. We are the artist of what we do. That's why no one else can do our massage better than we do. We are the experts at what we do. So we are the Bob Ross of our massage. We can paint happy little trees here. We can paint a nice little lake here, but we get to do massage. That's pretty awesome. It's a pretty awesome job. So there you have it, a rundown of how to work on upper traps, trap hood, mid traps. It wasn't too technical. I wanted to keep it simple. So if you enjoyed it, if you got anything out of it, let me know. Let me know if there's other areas of the body you'd like to see demonstrated. I'd love to share. So subscribe, help me out, let me know that you like what I'm sharing, and we'll see you in the future.